Hi, my name is Patricia. I'm an ICU nurse, a former sepsis coordinator, a COVID exposure team tracking member, and now, as of June 2020, a current UCLA nurse practitioner and clinical nurse specialist. Anyways, it was a really challenging, hard, and expensive experience, but 1000% worth it. So where to begin? A little bit about myself. I was born in Los Angeles, California, then we moved to Nigeria, and I didn't come back till about the age of 7 when my mom started having some health issues. My father thought that at the time America provided the best health care, so we moved back here, and I remember being a little kid and helping my mom navigate through the very complicated and confusing healthcare system, and it was so frustrating. I can't imagine what my mom felt not even speaking English as her first language. These experiences kind of shaped me and molded me into the person I am, and kind of is the reason why I chose to go into healthcare. Fast forward, I now have been at Valley Presbyterian Hospital for a little bit over 5 years, and I started off in the ICU and I loved it. I love critical care. I really loved being the voice for literally the voiceless in my ICU, and I really learned in this high-tech critical care environment that it was also a rare opportunity to kind of work on high-touch skills as well. There's so much that happens outside of the physical. Many a times we know that, not every patient's going to make it, but there is a way to provide healing that is beyond the physical, that incorporates emotional and spiritual aspects. I learned that you can help a patient or their family go through some of the scariest and worst times of their life by helping them come to terms or closure with some things that are happening in their life. And I've been part of some really beautiful experiences that I never thought I would have the opportunity of being a part of. From that standpoint, I had the opportunity to become a sepsis coordinator at my hospital, and that learning experience, that learning curve was steep and challenging, but it has truly been one of the most amazing experiences in my career of nursing, and it really taught me things like how screening tools, policies, workflows, nursing and provider education, how all of these things can impact a patient and improve their outcomes without even touching them. Like, it was a mind-blowing experience. From that standpoint, I am now currently working with the COVID exposure tracking team, and we are in unprecedented times. I mean, we all are, but my hospital is putting together this team for the first time in its whole existence, and I am learning so much, and I'm so fascinated about how to isolate, prevent, and manage exposures that might be happening. And I really get to use some of my clinical nurse specialists and nurse practitioner education. So it's been an amazing experience. But now I'm starting a new chapter of my life, and it's nurse practitioner. I'm currently negotiating for my first ever position, and honestly, my motivation and goal behind it is to be the provider I wish my mom had, and hopefully to help all of those after her. So many times I feel like we get stuck seeing the diagnosis and not the patient, that I hope to represent the voiceless and the misrepresented. I hope to bring light to all of those people who are more than just a Caucasian male that all of our clinical studies and research trials have been about. I hope, like, in the next 5 years, to be the best clinician I can, to really hone in on the art of healing and science, and then from that point, in the next 10 to 15 years, be part of research and community outreach. I think that being an icon is about recognizing your accomplishments, but also knowing that they didn't just come off of you, that they were built with the help and support of your hospital, your teachers, your family, your friends, your mentors, and that it is your responsibility to pay that forward and to help others recognize and tap into the iconness in themselves. So I hope to inspire that in you, and thank you for your time. My name is Patricia, and I'm an icon.